Okay, good morning. This study is on epidemiology and management of patients who present with shortness of breath as main presenting complaint to an emergency department of a tertiary care hospital. This study was conducted over a period of 2 months in a tertiary care hospital. Uh, it was a descriptive cross-sectional study which aimed to study the clinical and non-clinical profiles of patients presenting with shortness of breath. There were 427 participants in the study, almost equal number of males and females. The institutional incidence of patients with shortness of breath was 11.2%. That means out of all the presentation, 11.2% percentage was patients with shortness of breath. And the prevalence of smoking in this group of patients were 23%. Most of the patients who presented were seriously ill at the time of presentation. That means they were categorized as category 1 and 2 in the triage category used in A&E. They needed intervention within 10 minutes of presentation. The comorbidities prevalent in this group were mainly cardiovascular and respiratory, but the cardiovascular comorbidities were more common than respiratory, such as hypertension, ischemic heart disease, and followed by bronchial asthma and COPD, the respiratory conditions. Most of these patients had commonly 4 investigations. Those were in the A&E. They were ECG, blood gas analysis, chest X-ray, and lung ultrasound scan. And the pattern of abnormalities we found is displayed in the column under investigation. The main initial diagnosis made in the A&E is displayed in the bar chart, which is more commonly acute pulmonary edema, which was very common, and followed by acute exacerbation of bronchial asthma, lower respiratory tract infection, acute coronary syndrome, and acute COPD. There were some patients with, there were quite a number of patients with sepsis, anemia, and some psychological conditions who also presented with shortness of breath as the main presenting complaint. When we look at the system support which was provided at A&E, more than 75% of the patients needed oxygen therapy in the A&E and as well as at the time of disposition. And quite a lot of patients, almost 1/3 of patients needed some kind of ventilatory support. There were two type of ventilatory support, non-invasive and invasive ventilation. Majority of them were treated with non-invasive ventilation, 130 out of 427. And there were some people, 10 people needed urgent dialysis, and another 12 needed inotropic support. And the mortality at A&E was 2.1%, which is fairly higher than compared to the other countries, which was 0.04%. And the main disposition, most of these patients, 90%, almost 90% were sent to general wards, and about 6% were sent to either an HDU or ICU. 3% of them were discharged home. When we look at the non-invasive ventilation, when we compare who needed non-invasive ventilation, the people who had initial respiratory rate of 30 or more and saturation of 92 or less, or the triage category 1 and 2, these group of people needed treatment with non-invasive ventilation compared to the other group where they had lower respiratory rate or higher saturation, or the triage category 3 and 4. So in conclusion, most patients with shortness of breath who presented to A&E were seriously ill and they needed immediate interventions. And the cardiovascular and respiratory comorbidities were highly prevalent among this group, and which reflected in their initial diagnosis. And significant proportion of people needed a form of ventilatory support, and which is predicted by initial high respiratory rate, low saturation, and triage category 1 and 2. Thank you.